Namaskar and greetings from National Association of Palliative Care for Ayush and Integrative Medicine. I am Dr. Piyush Gupta, National Secretary of National Association of Palliative Care for Ayush and Integrative Medicine and Secretary of Cancer Aid Society. Today with us we have the President of National Association of Palliative Care for Ayush and Integrative Medicine, Dr. Abhijit Dam, and
Hello.
Vice President of National Association of Palliative Care for Ayush and Integrative Medicine, Mr. Radhakrishna. So, hello and hi to all of you. We are starting this course, foundation course in palliative care. And I'll just like to ask a question to Dr. Abhijit Dam that how this course is going to benefit the students and why should students opt this course at all?
Well, this particular course has been designed specifically to address the needs not only of students but also of healthcare personnel and the general public as a whole, to bring about a broader understanding into what palliative care really stands for. So, the importance of palliative care, because in the modern society where with modern interventions, where the process of death and dying are often prolonged unnecessarily with technology, where suffering is prolonged, where there is loss of dignity and people are dying unnecessary, prolonged and painful deaths hooked on to life sustaining devices in intensive care units of large hospitals. So, perhaps this is not what we constitute as a good death. So, if we introduce the concept of palliative care to the public as a whole, it will definitely broaden their views and make them reflect back into the actual meaning of life as such. It will basically help you to be a better human being also, because compassion is at the base of palliative care. So, it will bring out the compassion in you, and which definitely will help you grow. So, this is how the course is very unique.
Thank you, Dr. Dam. And Mr. Menon, basically you are coming from Kochi, and Kerala is considered to be the only state which is having plenty of volunteers, and it is leading the country when it comes to palliative care. What do you have to say about it?
Thank you for the question. I am from Kerala, representing a wide range of volunteers, especially. As all of you may be aware, palliative care is a teamwork consisting of multidisciplinary professionals. They are doctors, nurses, paramedical staff, volunteers and social workers, the carers, and the whole community should be behind the success of the operation or the delivery of palliative care. So, taking in that perspective, the state of Kerala came forward way back in 1994. The first palliative care center was established in Calicut in 1994, and the idea behind the establishment of that particular organization was to promote palliative care in that particular state. So, way back in 2008, the government of Kerala, that may be the first government, maybe across the globe, that has launched the official palliative care policy in the state. So, side by side with the governmental agencies, the national non-governmental organizations took a major role, and the volunteers especially took a major role. And we can say that in Kerala state, the palliative care movement was led by volunteers, and they are doing wonderful job. And I also happen to be a part of the volunteering team from Kerala, and they are doing a lot of service to those who are in distress and those who are in need of support at the fag end of their life.
Rightly said. So, when we are talking about the volunteers of Kerala, so my question is that are these volunteers trained or do they have any qualification in palliative care, or are they only trained and they are doing the work?
Yes, that's also another good question. Actually, these volunteers are not trained in such a way that social workers, doctors, and nurses are functioning, but they have a mind. They have a compassionate mind. That is the motive force behind doing the service in palliative care. So I think with this introducing this type of online classes, such people or the community at large will be able to become aware of the importance and the need and the necessity of palliative care. They will come forward and they will get maximum skill in palliative care delivery. So this course will be a boon to such persons who are passionate enough to come forward and do service in a more scientific and evidence-based manner.
Thank you, Mr. Menon. And Dr. Dam, again a question to you. What made you conceive such courses? I've heard that National Association of Palliative Care has launched almost 3 months certificate course, then you are having 6 months fellowship and 1 year PG diploma. And these courses are unique as no other organization in the world is having such courses. So what made you think to launch these distance learning courses in palliative care exactly?
So, actually, the recent COVID scenario actually forced us to rethink in a manner so that education is not hampered. And one thing led to another. We started off with the basic certificate course in palliative care, so that the concept of palliative care could be spread to the masses and not necessarily just to allopathic doctors, because integration was at the helm of affairs, and we in an order to bring about integration of all specialities, not only all specialities but also the common man, integrating the skills of compassion which the common man can volunteer to us. So it was with that concept that the National Association of Palliative Care for Ayush and Integrative Medicine was basically formulated. And we started off with the certificate course, and over the period of time, seeing the overwhelming response of the course of the students and their need for doing further courses, further structured training in palliative care and more detailed training in palliative care, advanced training in palliative care, we gradually introduced the fellowship and also the diploma courses in palliative care. So it was basically need based, and the enthusiasm of the students and the need of the future which led us to formulate one course after another. And we did not stop at just focusing on doctors, nurses, healthcare personnel. We have also developed courses for volunteers, specifically for the common man, layman who can volunteer, specific courses, and Mr. Menon has taken initiative in spearheading that movement, and which we call the youth empowerment also. And in addition, to take care of the elderly and bedridden people at home, we have started another training program for the rural women. It is a part of empowerment of the rural women. So it's a structured 6 months training so that they can learn the basic principles of palliative care, basic nursing principles, so that there is someone to take care of the elderly, for the lonely elderly at home, for the lonely terminally ill at home. So that was another focus. And a third focus which we introduced, which is the first of its kind in India, is the death doula course called Farishte, which is basically structured around the local cultural factors. The local cultural and social concepts have been integrated into that course, and that is the first structured death doula course in India called Farishte. So we have not only focused on the students, we have focused on the general public, we have empowered women, and we have gone a step further into exploring various aspects of death, dying, and in afterlife also, by introducing the Farishte course.
Thank you, Dr. Dam and Mr. Menon. Dr. Dam talked about the YES program. So would you like to throw light on YES program? And maybe would you like to share something about the 2 years of NAPCM, about your members, chapters, and students?
First, I will say about the members. This organization was established on 21st May 2020, nearly 2 years back. But at that time, COVID was at rampant and we could not move around. Transportation was very difficult, and we often use the information technology for communication purposes. And in that we had detailed discussion among ourselves and found out that we can make maximum use of the information technology for popularizing palliative care during the COVID season. That is the one thing that we got. Anyway, COVID is a bad thing, it is an uninvited guest, no doubt about it. But during this COVID pandemic period, we could do a lot of things. Within the matter of 2 years, as Dr. Dam has rightly said, we have introduced a lot of courses, online courses, and also some offline courses, and one of them is YES. YES is Youth Empowerment and Service. As we all know, the aging population is on the increase. Now it is considered that 71.3 years is the average lifespan of male population. So there is nobody to look after those who are aged. Like me, I am nearing the old age population, and I don't know tomorrow what will happen to me. Same would be the case of a large number of people, maybe because of industrialization. You see, son and daughter children are staying in some other places for their daily bread and butter, education of children and all that. So many factors are responsible for making the older people lonely, and they are at the mercy of nature on most of the occasions. So in the other side, the youth, the younger generation has got wide potential, and they are enthusiastic in doing something for the cause of the common man. So balancing the two things, we thought that it would be appropriate maximum use of to exploit the youth or the younger generation for the cause of for the safety and securing of the older generation. So this is the principle behind establishing our youth empowerment service. So to be precise, youth empowerment service is what you call carpet bombing, we call it. We visit the educational institutions in the states and just make them aware of the importance and relevance and the need of palliative care, and those who are interested can join our courses later and deliver palliative care in their own local areas. That is the basic principle behind the introduction of YES. Regarding the chapters, we have got nearly 160 to 200 life members across the country in different chapters, because basically palliative care is purely localized. If we want to deliver palliative care in the right sense of the term, we should have local population to carry forward the message of palliative care to the grassroots level of the community. So with this end in view, we have nearly 38 or so of chapters across the country and one abroad, with 160 to 200 life members who are drawn from different walks of life. There are doctors like Dr. Abhijit Dham, and volunteers like me and Dr. Piyush. There are Ayush doctors, there are nurses, and people from other walks of life are also joining us to what you call strengthen the hands of NAPCM to deliver palliative care to the 140 crores of the Indian population throughout the country, especially in the rural areas.
Thank you, Mr. Min. So I think this NPTEL course is ideal for your YES students.
Yes.
And they can opt for this course.
Yes, definitely.
So probably this course is not only for the experts, but this is for you. Why? Dr. Dam told you that not only the quality of life matters, but it is also the quality of death. After 70, maybe any time, any member of the family may be going to die. But in the present scenario, what happens? We panic. We take the person to the hospital. He is taken to the ICU, and from ICU onto the ventilator. So the cost of death increases, and maybe after the death of the person, the entire family comes on the verge of financial breakdown. Let us not panic. Death is natural. That is going to come to the aged or chronically ill patients. So let us not panic. We should always learn and adapt to the scenario. And we have to understand that how the patient wants this death to come. And most of these patients want to die within their home, among their near and dear ones, not among the machines. So this course is for general public, housewives, community workers, doctors, nurses, and anyone who wants to serve the country and the people. Thank you. Have a great day.
Thank you.